chronicles of the 14th century often mention women who were declared possessed because of menstruation. Doctors and priests of that era believed that menstrual blood was a manifestation of a curse. According to the chronicles of the German principalities, a woman who began bleeding during a holiday was taken out of the city and kept in isolation so as not to pollute the air. Monastic records state if a woman in the house had a period, the blood would go stale, the milk would sour, and the children would get sick. She should be removed from the fire and prayer. This is how the practice of expelling women from temples came about. In some cases, they were forced to undergo purification, dousing with cold water, taking out into the cold, sometimes burning herbs, and fumigating with smoke directly between their legs. In the 14th century, the concept of diabolus in corpore, the devil in body, appeared in France. It was believed that the uterus with blood was a vessel for the devil. Women who were menstruating could be tortured to extract a confession. The following lines have been preserved in court documents. The wife confessed that she felt a burning sensation in her lower abdomen every month. The judges ruled that it was a demon drinking her blood. After that, women could be executed as witches. In Spain, the Inquisition practiced special methods. Women who were found to be menstruating at the time of interrogation were placed in a purification chair, a round chair with holes. A fire was lit underneath it, and the woman was forced to sit there until the blood coagulated. It was believed that this would burn away the impurity. Records show that women died from burns or exhaustion. In the East, the practice took a different form. In the Ottoman Empire, women during menstruation could be subjected to therapeutic bloodletting to drive out the madness. The doctor would cut the skin of their arms and legs to release excess blood. If a woman screamed, she was declared possessed. Then they would use spells and cauterization with a hot iron on the stomach or pubic area. In villages in Eastern Europe, women who were menstruating were sometimes forced to sleep separately in barns. People believed that their breath was poisonous and that their gaze could cause illness. Girls who had started their first period were humiliated. They were taken to the square and forced to sit on the ground while priests or clergymen recited prayers. The chronicles of 17th century Russia mention shameful purifications. Girls who had their first period were sometimes whipped on their buttocks and thighs so that the blood would not rot inside. Medical books of that time prescribed if the blood flows excessively, apply leeches to the perineum and tie a cold cloth around the abdomen. All this was accompanied by fear on the part of society. People were afraid of the menstruating women, but at the same time, they accused and tortured them. The chronicles mention cases where women remained unburied after execution. Their bodies were considered unclean. By the 16th century, during the Reformation, attitudes toward menstruation became part of political and religious struggles. The Catholic Church continued to consider menstrual blood a sign of damnation, while Protestants declared it proof of women's natural sinfulness. But regardless of damnation, women remained subjects of humiliation and punishment. The archives of the Geneva courts for 1543 contain the case of a woman accused of burning the harvest with her menstrual blood. She was forced to undergo a test. She was kept without food or water for 3 days, and then publicly brought to the square. A priest read prayers, while a doctor examined her perineum and vagina, trying to find traces of the devil. The woman could not bear it and lost consciousness. The chronicles record she was found guilty, for during the examination, the devil caused her to bleed. At this time, medical treatises began to describe menstruation from a physiological point of view, but if the approach remained cruel, the physician Ambroise Paré wrote in his works that menstrual blood is poisonous and can poison a man upon contact. He suggested cleansing procedures, burning cold water, applying leeches to the labia, and cauterizing with iron in cases of heavy bleeding. These methods became common practice in hospitals. In 17th century France, women with abnormal menstruation fell into the hands of not only doctors, but also priests. Reports on so-called blood witches stated they are capable of causing hail and pestilence, for their blood is a curse. Such women were tortured, they were hung by their hands, forced to kneel on stones, and during menstruation, they were subjected to purification by smoke. Streams of liquid smoke from burning sulfur were directed at their perineum. In Italy and Venice, in 1627, a case of a medical experiment was recorded. A woman whose menstruation lasted too long was placed on a stone table, and her abdomen and pubic area were burned with red-hot metal. Doctors claimed that this would burn out the disease and the devil. The chronicles record that the woman died on the third day from gangrene. In England in the 17th century, Puritans saw menstruation as a sign of debauchery. Girls who started their first period were subjected to humiliating rituals. They were forced to undress to the waist, and, in the presence of elders, received blows with a rod, so that the blood would not spread. Sometimes cold stones were applied to the stomachs and perineums. This was considered to moderate the passions. It is stated that even doctors continued to describe the female body as unclean. In a medical treatise from 1689, we read, "A woman's womb is a vessel in which rotten fluid accumulates every month. Its discharge is a cleansing act, but if the fluid stagnates, the woman becomes insane and possessed." Based on such ideas, autopsies were performed. The doctor made incisions in the thigh or abdomen to drain the excess blood. In German principalities, women with heavy menstruation were sent to special houses where they were cared for. In reality, they were tortured. Medical records document the use of iron gynecological chairs, where women were restrained so that their vaginas and uteruses could be examined. The examination was rough, using metal hooks. In cases of heavy bleeding, doctors would sew up the entrance to the vagina with coarse thread to stop the flow. This led to inflammation and death. The Reformation also gave rise to new forms of punishment. A woman who was considered possessed because of her period could be publicly displayed at the church. A sign saying "unclean" was hung around her neck. People threw mud and stones at her. Some could not bear it and ended their lives by suicide. In Eastern European lands, there was a practice of bloody confessions. Girls who had their first period were brought to a priest, who made them kneel, asked them questions about their sins, and if he noticed blood on their clothes, he beat them in the legs with a rod. Records indicate this is necessary to expel the demon that feeds on blood. Doctors and priests worked together to reinforce the atmosphere of fear. Women were taught that the uterus and vagina were vessels of evil. The clitoris was called the root of lust. In cases of hysteria or convulsions, women often had it removed, believing that it was unclean blood that fed the organ of sin. Thus, during the Reformation and early modern period, attitudes toward menstruation did not become any more lenient. On the contrary, the combination of religious superstitions and primitive medicine gave rise to even more sophisticated forms of torture. Women who were menstruating were subjected to cleansing procedures. Their vaginas were sewn shut, their uteruses were considered the source of the devil, and their blood was considered a poison that needed to be expelled. The 18th and 19th centuries brought new forms of violence against menstruating women. In Europe, the influence of medicine grew, but religious ideas about unclean blood persisted. Now, they were accompanied by pseudo-scientific rhetoric about female diseases. French hospitals at that time practiced regular medical examinations. Women with heavy periods or severe pain were placed on wooden tables. Doctors used metal vaginal dilators, which were crude in design. The examination was accompanied by screams and loss of consciousness. If ulcers or inflammation were found, the doctor cauterized the tissue with acid or iron. Medical records state pain is necessary to burn away the disease, for poison lurks in the blood. In 18th century Germany, there were correctional homes for women with abnormal periods. Doctors believed that such women were prone to hysteria and crime. They were locked up and examined daily. Bloodletting was practiced. Up to a quarter of the blood was drained from the veins in the arms and legs. Women had bags of ice or stone slabs tied to their stomachs to stop the flow. Reports indicate that many died from hypothermia and weakness. In 18th century England, the theory that menstruation was a source of madness gained popularity. Doctors wrote that blood rises to the head and causes hysteria. Girls with severe pain and unstable cycles were placed in psychiatric hospitals. There, they were given electricity treatment. Electrodes were applied to the body, including the abdomen and perineum. The women screamed, but the doctors claimed that this is how the devil leaves the room. In the second half of the 19th century, surgeons began to perform operations. Removal of the clitoris became a fashionable method of treating hysteria and excessive menstruation. Dr. Isaac Baker Brown in London actively practiced such operations. He wrote, "Removing this organ stops the attacks and cleanses the womb of lust." Many of his patients died of infection or were left disabled. In 19th century Russia, women with heavy periods were called uterine possessed. They were treated with cauterization. Doctors used red-hot metal rods, which they applied to the abdomen or pubic area. Sometimes they washed the vagina with vinegar or wine. Girls who could not withstand the pain died of shock. Public purification rituals in Eastern European villages were particularly humiliating. A girl who had her first period could be taken to the square, made to kneel on a cold stone, and fumigated with herbal smoke. If she was bleeding heavily, she was forced to hold hot coals in her hands until she collapsed. This was considered a sacrifice to expel the devil. In the colonial areas of the 19th century, the attitude toward menstruation was also cruel. Women who were used in garrison brothels were subjected to weekly examinations. During their periods, they were isolated, considered unfit, but isolation turned into torture. They were kept without food or water until the bleeding stopped. Doctors noted, in cases of heavy bleeding, it is recommended to sew up the vagina for a while. Women often died of inflammation. Medical treatises of the time directly linked menstruation to sin. In a German book from 1824, we read, "The womb is the vessel of the devil, and its blood is poison. Every woman is obliged to endure cleansing procedures." In practice, this meant bloodletting, leeches on the labia, vinegar douches, and cauterization. In France, at the end of the 19th century, opium began to be used to calm women during menstruation, but the doses were enormous. Women became addicted, lost their minds, and died of overdoses. Their deaths were explained as the result of demonic illness. Psychiatric hospitals in Europe and the United States recorded hundreds of women diagnosed with menstrual hysteria. They underwent surgery to remove their ovaries and uterus. These mutilations were presented as medical care, but in reality, they were crippling practices that deprived women of their lives or health. Thus, the 18th and 19th centuries did not ease the fate of women with periods. On the contrary, new medical methods intensified the torture. The vagina and uterus became objects of surgical experiments. The clitoris was removed in the name of treatment. The perineum was cauterized with acid. Women's blood continued to be considered a symbol of the devil. By the beginning of the 20th century, it seemed that science and medicine would finally destroy the old superstitions about unclean blood. But in practice, they only changed the form of cruelty. Women remained the object of control and humiliation, and their periods were considered a disease requiring intervention. At the beginning of the century, special gynecological clinics appeared in Europe and the United States. Girls who complained of pain or heavy periods ended up in the hands of doctors. There, they underwent cleansing procedures, washing the vagina with carbolic acid or vinegar solutions, cauterizing the cervix with sodium nitrate. All this was done without anesthesia. The women screamed, but the report simply stated, The patient was agitated, but the treatment was successful. In Germany and Austria, clitoridectomy continued to be performed as a method of treating hysteria and menstrual disorders. Women with severe pain or nervous seizures were placed in psychiatric hospitals. There, they were prescribed surgical intervention, removal of the clitoris, or even the entire uterus. After the operations, many died of blood poisoning, but the doctors recorded the attacks have stopped. In World War I camps, female prisoners were subjected to humiliation. During menstruation, they were declared unfit and isolated. In some camps, there were cases where women with heavy periods were forced to sit on stone benches in the cold until the bleeding stopped. Medical reports noted several women died of exhaustion. The rest were declared purified. During World War II, the cruelty reached its peak. In various novels and in the Japanese comfort women system, menstruation became a reason for torture. Women were examined daily. If someone started her period, she was subjected to humiliating cleansing procedures. Doctors often inserted metal instruments into the vagina and washed it with caustic solutions. Sometimes they sutured the labia to stop the flow. There were cases of clitoris removal, supposedly to reduce arousal and pacify the spirit. In the memoirs of Korean survivors, we read, when we got our periods, they called us possessed. The doctor touched our vaginas with his hands and examined our uteruses. If we cried, they said we had the devil inside us. One girl had her vagina sewn shut with thread, and she died 3 days later. These testimonies became part of the evidence in post-war trials. In post-war medicine, attitudes formally changed, but did not disappear completely. Until the 1960s, doctors in Europe and the United States continued to explain many illnesses as menstrual hysteria. Women were prescribed electroconvulsive therapy, given sedatives, and sometimes sterilized. The protocols read, the patient has a heavy cycle. It has been decided to remove the uterus to stop the symptoms. Only at the end of the 20th century did a rethinking begin. Women's movements began to demand recognition that for centuries, menstruation had been a reason for abuse, executions, and mutilating procedures. Historians and doctors dug through archives and found chronicles describing torture, purification chairs, cauterization of the perineum, bloodletting, vaginal stitching, and clitoridectomy. The political consequences were noticeable. In Asian countries, the memory of comfort women became a symbol of struggle. In Europe, historians have shown that even in the 19th century, menstruating women were victims of surgical violence. In religious communities in Eastern Europe, even in the mid-20th century, old people still remembered shameful purifications, when girls who had their first period were taken out into the square. 20th century doctors gradually abandoned the term unclean, but the memory of it remained in language. The idea of the devil in the body turned into medical myths, that menstruation causes madness, that it spoils food, that women are dangerous during these days. These superstitions continued to live on among the people. Women's deaths due to such practices were still being reported in the middle of the century. A 1952 medical journal describes a case. A 16-year-old girl was admitted with inflammation. It turned out that her vagina had been sewn up according to custom. An autopsy revealed tissue necrosis. Death occurred on the second day. Thus, the idea of the devil in the body lived on for many centuries. From the fires of the Inquisition to the operating rooms of the 20th century, women's blood remained a symbol of fear. The vagina, uterus, labia, and clitoris became objects of torture and surgery. Women were humiliated, mutilated, and killed. And all this was presented as purification, treatment, or protection of society. The consequences were tragic. The deaths of thousands of women changed families and communities. The memory of them gave rise to new movements, new laws, and new ideas about rights. But the chronicles remain dry lines, reminding us